Hey, I'm Justina, and I'm gonna be doing trach care today. I'm gonna be suctioning the trach and providing the care, cleaning it. So the first thing I'm gonna do is I'm gonna verify my physician's orders. I'm gonna wash my hands, and then I'm gonna identify my patient using 2 identifiers. I'm gonna explain to the patient what I'm about to do today. Then I'm going to hyperoxygenate. I'm going to use the ambu bag, and I'll do this for at least 30 seconds. I've got my watch on and I'm watching. I would do 4 to 5 slow, deep breaths. So I did that. And now I'm going to open up my suction is set between 120 and 150. So I'm going to open up my catheter kit. Okay, this is my normal saline. I'm lipping it, and I'm gonna pour it in here. Then I'm gonna go ahead and check and make sure that my suction's working, and it is. Here, and my assistant's helping me today. Okay, this is my catheter, and I've got to keep all of this sterile. So I'm trying to kind of wrap this around. Okay, so I've hyperoxygenated, I've got this, I'm still sterile. Now this hand's not. This isn't working just correctly, but we're gonna pretend that this was attached to here. And so now I'm going to put this in the trach about 4 to 5 inches or until they cough. Okay, and then I'm gonna pull it out intermittently, suctioning it, and do this for no more than 10 seconds. So I've suctioned them, they're clean. And I'm gonna hyperoxygenate again for another at least 30 seconds. So I've suctioned them, and now I'm gonna perform trach care, and I'm gonna clean. Get all this out of the way. We're gonna put that in the garbage. Okay, we don't need this either. Okay, let's see. So first, I'm going to get my hydrogen peroxide, lip it, pour about half in here, and half normal saline. Lip it, pour it in, then pour normal saline into this part right here, or both parts, normal saline. So now I am going to take my trach out. And put it in this peroxide and the water and let it soak for a second. It's soaked. Now I'm going to take my brush and I'm going to clean out the inside real good and get the gunk out. Got the gunk out. Now I'm just gonna making sure that I only touch this bottom part right here because I'm trying to remain sterile. And clean the outside off. Put put that in the garbage. And then I take these little pipe cleaners and I'm gonna make sure that I dry this off really well before I put it back in. Well, before I dry it, I did not rinse it. So I washed it, but now I'm gonna rinse it. I'll rinse it off in the normal saline. It's rinsed. Now I'm gonna dry it off. So dry. There we go. Dry it really, really good and make sure there's no moisture. Then I'm gonna take this 4x4 and dry this. And then I'm gonna put it back in. All right, and now I'm gonna remove this dirty dressing. And in the clean normal saline that I haven't used yet, get a Q-tip. I'm gonna clean under the plate from top to bottom. Do the other side, top to bottom. And do the top of the plate on each side, top to bottom. So that's clean. And now I'm gonna put my clean dressing under here. And I'm gonna untie the tie on one side, but I'm gonna leave this side tied up and get my tie. And while I'm doing this, I'm making sure that my patient's breathing okay and they're not having any difficulty or pain, and my patient's doing good right now. Okay, come around the head, untie this tie, get rid of that. And you want to make sure you leave at least 2 fingers of space in between this tie and the neck. Tie that off and probably trim some of this excess off. And then, and I just want to make sure that I leave my patient comfortable. I'll probably give them a little more oxygen after all of this too, just to make sure, hyperoxygenate them. I'm gonna dispose of all of my materials and wash my hands and document. Thank you.